Or you're looking to retire in Africa, but you're not sure which country you may want to go to? Well, in this video, I'm going to explain why you should be looking into Zambia in the southern region of Africa, which is part of the SADC. Hey, Jason here. If you've been watching the channel, you've been seeing as the last 2 years, I've been making my way throughout Africa, the southern region, and looking for a place to where not only is it simple to actually get permanent residency, but where it's going to be a good place that hits safety, and you get your bang for your buck, you have the opportunity to invest, and you have good health care. And so today we're going to talk about Zambia. So if you didn't know, I'm now a permanent resident of Zambia, so I don't have to be traveling from country to country every 90 days. And so one of the things I've been starting to do is to actually settle in. If you've been watching my channel for the long run, you saw when Cece and I first moved to Panama, when we moved to Colombia, to where she ultimately passed away, and then you started seeing me pick up my life and carry on out throughout the continent of Africa. I've been to South Africa, Botswana, and Zambia, and I have full permanent residence here in Zambia. And so one of the things I've been doing that I haven't actually explained to you is I've been getting insurance here in Zambia. So once you get your NRC, which is your national registration card, even as a permanent, and once you get your residency, you are able to get insurance here. And I have to be and tell you the truth, like I'm highly impressed with the insurance, especially with how much it costs. And so make sure you keep listening. I'm going to share exactly how much I pay in Kwacha and US dollars. And so first thing, the national health insurance here is called NHIMA, NHIMA, which is National Health Insurance Management Authority. And it's very simple to get. All you have to do is once you get your NRC, and this is just I'm not going to show you the exact detail, but this is what the NRC looks like. And what you do, you just also caveat, have copies of your NRC at all times. And what I mean by that is you're going to always need a copy, whether you're buying traditional land. You probably don't need a copy if you're getting something done in a place. It's just good to always have a copy, and you will need a copy of it when you're getting your NHIMA insurance to register. And so what you'll actually do for registration, well, before I explain your registration, let me explain where do you go. You go to UTH, which is University Teaching Hospital. If you're taking a Yango, just put in there UTH outpatient department, and you'll go literally right in there. And once you go through the glass doors, it is the first door on your right hand side, and that's where they actually do NHIMA registration. Very simple to get to, not much traffic. If you're a little confused, just ask one of the security guards there. They are very helpful. They do understand English for my Americans out there. You're not going to have a problem communicating, and it's really a simple process. It's going to take you no more than 10 minutes, and that's only depending if there's just a lot of people in front of you. But it's a really quick, simple process. And what you're going to need when you take there is just a copy of your NRC. Like this is my copy of my NRC. And what you want to do is you can have it pre-filled out, or you can let them fill it out. You want to have your phone number on there because they're going to send you a text message with your registration number, member number, and your temporary password for when it's time for you to log into the portal. Where you live, your exact address, and you're going to put your occupation. If you're working, if you're retired like me, you'll put retired. And they're also going to ask you if you're married or single. And the last thing that they asked was highest degree of education completed. And those were the only things that they asked. And you turn that in and you're done. Literally done. I was shocked. I was like, the person I was with, I was like, this is all it takes to get insurance here? I'm like, this is it? And they were like, yeah, that's it. Now we just wait for the text message. And make sure your phone number is very legible. Like here, they write their four is different than how I'll write them in Texas. So if your numbers are not going to be legible, let them write it out. Just make sure you tell it to them clearly and check over it, because you do not want it to be the wrong number. It will delay you a little bit. And I'm going to explain you how that happened to me now. So I accidentally, or he heard me wrong, because there's a lot of traffic going on. So you want to make sure everything's correctly the first time. One of the numbers were wrong. All I had to do was call the 8,000 number and call customer support and just let them know, hey, this is my NRC number. They looked me up, told them this is the actual phone number. They put it in there, changed it. However, they have a backlog. So like any other official department, they're backlogged. And so it did take about a month for me to get my registration number and a temporary password so I can go on and start making my contributions. Contributions are your payments. And so I'm gonna let you know how much I made. But just make sure you have that number in there legible because it saves you time. The person I went with, they got their message in 2 days, and it took me about a little bit over a month. So just to save time, just make sure it's in there correctly. But if you do mess up, customer service is really good. Their English is great. You're not going to have a problem understanding them. If you're coming from the U.S., just talk a little slow because when we're comfortable speaking English, we talk fast, especially if you're from like the East Coast or Jersey, places like that. Even here with me being from Texas, I do talk fast in our accent. So just talk a little slower if you are speaking with customer service. Just be mindful of that. Because, just like how it is for us in the U.S., when we're speaking to someone on the phone, it's not always the best reception. And sometimes accents and speed can really change the dynamic of that conversation. So just do that so you're not stressing yourself out anymore. But if you can make sure you have the number correctly, please do. It's just going to save you a lot of time and less headaches so you don't have to be stressed out. So now once you do that, you go on your portal. And the portal is very easy to log into. And it's going to tell you there, let me log in on mine real quick. It's going to tell you have a 4-month window of that you are in probation, essentially. Let me do this, sorry. And I'm just going to keep this all on the video. I might cut it out. And then once you first log in, you're going to go on members, put in your registration number, and then also put in the temporary password they sent you. Once you do that, it's going to have you change your password. So give yourself a password that you're not going to forget, and you'll be good to go. Then once you log in, it will show your name, welcome to NHIMA, your member ID, your national ID number, which is your NRC, number of beneficiaries, and last contribution. Now, your contributions are your actual payments for insurance. Now, with NHIMA, you have a 4-month waiting period until you can start using the insurance. And it just says you must have been registered with NHIMA for at least 4 months. And that's it. And so you are going to have a 4-month waiting window. So be cautious of that and have an understanding it's going to take 4 months before your insurance actually kicks in. And it does cover dental. It covers some physiotherapy places, some chiropractic places. So it has a wide range of coverage. And as I start learning more of the things that it covers, I will let you know. I can tell you, like for me personally, with my spinal fusion, like this last 2 weeks, I've been kind of out of it because I had a real bad pinched nerve on my sciatic nerve. And if my NHIMA was already intact, my physiotherapy would have been covered through my health insurance. I'm paying about 1,000 kwacha a week out of pocket, and that would have been completely free with NHIMA. So it's really good insurance. Even my next cleaning at the dental, they told me because I have NHIMA and they take it, it'll be no cost at me. And then I'm gonna see how much it costs to actually do a root canal also and let you know. And so it's gonna say your status, waiting period in effect. And for your contributions, this is your payments each month. Now, I just paid 5 months up front. And this is the reason why. Let me get my phone out for this because you're going to be shocked how much I'm actually paying. And so 5 months up front, I paid them 300 kwacha. I paid $11.46. So each month is 60 kwacha, which is $2.29 with what today's exchange rate is. For the year, I will be paying 720 kwacha. We're talking about $27.52. Please tell me if your insurance costs that low and you have dental covered and you'd be able to go to the physiotherapist. I'm the happiest man on earth right now. I'm going to be honest with you. I did not expect a good insurance coverage at a price like this. This is just amazing. And this just shows another one of those hidden gems that people are not talking about within some African countries, especially here within the SADC, the southern region of Africa. It has great healthcare coverage here. You have great doctors here. This is the only country, I'm going to be honest with you. There's so many nurses here that are, if you have a medical emergency somewhere, I'm pretty sure if there's 5 women around you, at least 1 or 2 are going to be a nurse. There's tons of nurses here, people who are very highly qualified. And it just shows you how good of a medical system that is here. And I'll be actually going to one of the private hospitals using my insurance. Like, I'm not going to be, it doesn't mean you're in the public hospital like in the United States where you're sitting there for hours. This is being able to go to a private hospital. And so that is something that's really cool. And the hospital that I'm going to be going to is an actual military hospital. So it's a government hospital. And I just wanted to share that with you today because there's a lot of beautiful things about this southern region of Africa. They have their goods, they have their bads, and we need to just start seeing what are some of the things for if you're just looking to relocate and stay here within Africa, especially if you're retired military or government pension. You can literally get a big bang for your buck coming here to Zambia. Like my 2 bedroom, 2 bath